So acute inpatient rehabilitation is an awesome opportunity for folks who they've come to the hospital and they've had usually a pretty devastating injury, or even just some type of hospitalization where they've lost strength and need to return to their normal function. But they're not ready to go home. They're not safe to go home. They need more supervision and monitoring in an environment where they can regain their function. And so acute inpatient rehabilitation is really a program that's unique in that the services offered are 3 hours a day of therapy divided throughout the day with at least 2 different therapy disciplines. And they need medical oversight by a rehab-trained physician, and they need to require the resources of an interdisciplinary team that consists of nurses, pharmacists, like I said, therapists, physicians. Some folks that have amputees will need a prosthetist, somebody to help them fit a new prosthetic leg. And that process can be started on inpatient rehab. And so really, bottom line, inpatient rehab is a wonderful interdisciplinary team approach, patient-centered, patient-oriented program to help folks return to their prior level of function. The most common injuries that people have that require this type of service is usually a spinal cord injury, a brain injury, a stroke. We've actually seen through the COVID-19 pandemic, we've seen a lot of folks that have had COVID, they've been in the ICU for many days, and they get what we call critical illness myopathy, where they get really deconditioned, muscles get weak, and they need help with coordinated, targeted therapy to improve their strength and function. Those are the main ones. We also have some folks that come in after hip fractures and multiple, after a car accident, they have multiple injuries, or someone that has a hip fracture that required a replacement or repair, and they're not able to go home, and they have some coexisting medical ongoing issue that needs the supervision of a doctor. The biggest difference between acute inpatient rehab and other types of rehab you might find in the community is that we are able to provide 3 hours a day of therapy. That's a much higher intensity therapy than any other rehabilitation around. That's considered more skilled nursing level. The nurse to patient ratios are very good here. So usually one patient, one nurse will have about 4 to 5 patients, which is a really good ratio. So they're more attentive. They have emergency services that are here on site. And so, for example, somebody who has had a stroke and then they start showing symptoms of maybe extending or having a new event, we have the ability here, me as the medical director, and I'm always around. And then also we have the hospitalists that are also rounding on patients, have that ability to come evaluate somebody very quickly and order CT scans, labs, other imaging, whatever is necessary. So we have all of that on site. And so the care team is also here. And so all of the doctors that have been taking care of the patients over on the acute side are also privileged here. And so if we need the orthopedic surgeon to come look at a wound, if we need the cardiovascular surgeon to come and reassess, all of that is here. And we can have folks seeing nephrology, kidney specialists, cancer specialists. All of those same services and physicians that are on the acute side can come here, which is a great blessing for folks that may need a little more assistance. Whereas if they were in the community, an appointment would have to be scheduled, or if there is an emergency, they would have to just call 911 and go to the emergency room. So I think those are the things that separate us. If they have questions, they can reach out to our clinical rehab liaison, Jennifer Pulcher. She is the one that helps coordinate all of our admissions, and she can be a great resource, and we, we're willing, and she's willing to bring folks over here, and they can go on a tour before they choose to come here to make sure that they feel comfortable with it. Case management, wherever they're at, or your primary care physician can also contact me, and we can have a discussion about if it's a case where somebody's at home and they're just not doing well, and they need higher level of rehabilitation. Then the primary care doctor can call me, and we can see what we can do to get somebody approved to come here.